Thank you so much. And amazingly, the numbers taking part in this event have just stayed pretty constant all the way through the morning. So I completely take my hat off, especially to those of you living with long COVID, for keeping your concentration levels. Margaret, just a wee bit of warning that I'm going to come to you first.
Okay.
Yeah. So thanks again, everyone. I'm sure the conversations were equally as constructive and important in the second breakout session. So what we're going to do now is we're just going to give ourselves a flavour of what went on in each room. And I'm going to do that by asking each of the facilitators to just do a short feedback on the kind of consensus, the main points of your discussion. So I'm going to start with Margaret, and then the next person I'm going to come to is going to be Gillian, just to give you a bit of advance warning. Margaret, over to you, please.
Okay, thank you. I just want to start by saying thank you, Alan, and to Long COVID Scotland for inviting me to be here today. I'm really delighted to be here, and I can't say how much admiration and support I've got for all the people who contributed today, and I doubt I'll ever forget the stories and the experiences I've heard. So I just wanted to say that just now. But a huge thank you to those who joined me in breakout room 1, and I could have probably stayed chatting all day. However, the main sort of points that we felt that should be happening now, and I'm going to combine the feedback from both the chat out rooms. And we found both the sessions, we found it very difficult to prioritise what our recommendations would be, because they're all directly linked and all of equal importance. But what we thought that we should have is absolutely the voice of lived experience should be an absolute core of any discussions, and any discussions particularly around service redesign and delivery, that only people living with long COVID or those directly affected by long COVID know the impact it's having on their lives. So that was one of our recommendations. Number 2 would have been having, and I think it's been mentioned earlier on, is having long COVID centres. In fact, one of the ladies in the group said long COVID centres 1, long COVID centre 2, long COVID centre 3. She felt that so strongly about it. But these centres should be local at health board level, if possible. Perhaps if it's a health board like Greater Glasgow and Clyde, it should be maybe 2 or 3, given the size of the area, but also a national centre for excellence. And along with that, there should be very sort of clear and robust mechanisms for sharing the learning from all the people that are being seen and being treated, and watching what's happening and listening to what's happening and responding to what's happening sort of nationally and internationally. Learning from countries that are much further ahead in dealing with this crisis than perhaps Scotland is. And I think thirdly, sort of very clear and consistent care pathways, sort of integrated, coordinated sort of pathways of care. And that again, everybody in the group thought that was absolutely vital. But I think what I want to say is that we couldn't really prioritise any of them, that should all happen at once and all just as important. But one thing that one of our group did say is that we don't know how many people we're talking about, and it's vital that we know how many people are living with long COVID, and then add to that the number of people directly impacted. And we heard Graham's very powerful story there of the impact it's had on him as a husband and a father, and the impact it's had on their family. We don't really know the economical and the financial impact it's having in the country, and that is something that we also have to consider. But somebody in the group said that what would really be helpful at this stage would be having the First Minister standing up in the Parliament and acknowledging that this is a crisis, and a crisis that has to be given full attention to. So that was really the gist of our very fruitful and helpful discussions.
Thank you, Margaret. That's a really good start to the feedback. Thank you for being so clear. And if you weren't able to see that, there was lots of nodding going on as you were going through those points. So I'm going to come to Gillian, and then I'm going to come to Alan. Okay, so Gillian, over to you and your group, please.
Yep, thank you. Similarly, we had some really great and useful contributions, so thank you to everyone in my breakout room. In addition to points Margaret made, because we had a lot of similar sort of points, but we did discuss the narrative that there is that children don't get affected by long COVID. So there's a lack of awareness that kids don't get long COVID, and there's a need for urgent mitigations in schools in terms of things like better ventilation and air quality. There's also very mixed guidance and confusing messages around education. So we discussed the need for some sort of national guidance that's not ambiguous or open to interpretation and much more consistent. There was also the discussion of paediatric champions for long COVID, which I think was mentioned. It's in place in England, so introducing something similar in Scotland would be really helpful. And we also spoke about the intersectionality between sort of childcare and the financial implications and how that impacts on long COVID. There's also need for more transparency from the Scottish Government. There was discussion of blocks in the system, how we don't know the processes, plans and actions, and how voices of lived experience are informing them. So there needs to be much more transparency around that. We need to push for a coordinated long COVID support, change the language that we use, and really push for that coordinated, holistic approach. We also spoke about statistics and data. While there's a lot of qualitative data out there, there's much more need for quantitative data to really emphasise the scale of long COVID and the impact that it's having. And as Margaret mentioned, we focused on the diversity and lived experience of people with long COVID. We really need to acknowledge that and put lived experience at the centre. And we also touched on the role of sort of unpaid carers and all of this and the financial implications and the practical support that's needed. So yeah, I think I'll stop there, but a key summary.
Thanks, Gillian, that's really helpful. So I'm going to move to Alan and then to Teba. So Alan, over to you.
Hi everyone. Yeah, I think we've heard from some of the previous two feedback speakers that we've had quite a lot of the similar discussions in our group. Really useful, really important discussions. I've sort of got three things I sort of want to add that came out of our conversation. The first one's about sort of a change of culture, and something that was threaded throughout all our discussions were about that sense of being believed, and that people were feeling that they weren't being believed. They were going to see their GPs and they weren't being taken seriously, and they were having to fight tooth and nail to get basic investigative procedures and treatments. And a term that someone used that a lot of the participants in our group really quite liked was we want GPs to have a sense of curiosity, to realise there's something here that they can learn about, and that it's okay to be unsure. People don't need to feel like it's a failure if you're a medical professional to not be sure about something. You can take it as an opportunity to learn together with that person, and to accept that anyone can have long COVID, and be open to sort of diagnosing that as a condition they have, and working together to get a solution. Another thing we had in our second chat in particular was about sort of pacing and rest, and how important that is to prevent people from making themselves worse, and that it can be very difficult for people to adjust to that sort of change in their life from where they were able to do lots of things previously that they're now not able to, and perhaps they try and push themselves too hard to do them, and that causes them to feel more ill. So providing people with support with pacing, perhaps as access to a mental health professional who's able to sort of help them understand and to explain how pacing is important and why they should do it. And then also the third and final point is about sort of the importance of time to listen and to reflect, and that's both with medical professionals themselves, like actually being able to have a quality of conversation with them, and not just be seen really quickly and sort of then passed out the door, but also how important peer support is. And a lot of people saying, and I think we've heard at other points today as well, that people were feeling really lost and alone. And then when they found there was a peer support group of people who were going through a similar experience, that was transformational. Being able to access that and to share the experience, and also to share advice and support around not just the condition itself, but things surrounding it, like money issues that might have arisen, and also having sort of condition appropriate activities. So a couple of people mentioned doing like really easy to access and not heavy going yoga. That was a way to sort of do a bit of exercise, but also have conversation and discussions around it. So I think those were sort of the three of the big things I wanted to focus on. Of course, we had a lot of the same stuff around, the need for dedicated services, and multidisciplinary approaches.
Thank you, Alan. So after Teba, I'll come to Christine. Teba.
Hi everyone. First of all, thank you to the group for all their contributions, and it's been really interesting to hear everyone's views around long COVID. So the kind of discussions we had were around kind of national level and employment support. So first of all, the government should attend meetings. So the health board should take a coordinated approach, and there needs to be a level of recognition and validation across the services. So someone should be there that listens to your voice at a national level, and people should be able to participate and get the voices heard. So generally a person-centered approach. Employers need to understand the scale, kind of the need, and also the sickness and absence policies needs to be revisited. Kind of taking into account long COVID. Perhaps a furlough-like scheme could be created for long COVID. There needs to be kind of recognition in the Equalities Act for employers, the Disabilities and Equalities Act. Other point that we mentioned was there needs to be a campaign in Scotland around long COVID, similar to kind of England. Again, a cross-party group which gets people's voices heard, a coordinated care going across multidisciplinary teams, and financial support for organisations as well, especially ones that are supporting people with long COVID. And also a dedicated website should be available for everyone with all the information, information about support services, places that you can go to, people that you can receive help from. So those are kind of the key things that we discussed, and some similar echoes around the other groups as well. Thank you so much.
Thank you, Teba. So I'm going to move to Christine and then David. And the final four feedbacks, you just start following that rule of not being repetitious, but being really clear about where you agreed with previous feedback. So Christine, over to you.
Yes, thank you to everybody that was involved in my breakout group. Our main points were not to be repetitious, are basically all covered. One thing to do with knowing the numbers was also to be publicising those numbers in a wider aspect across the country. In doing this, we would support kind of more funding, more research, more awareness for everybody about the condition. And I won't repeat all the things other people said, which was to do with, the support for the GPs and etc.
Yeah.
Thank you.
Thanks, Christine. Sorry to land you with that no repetition line. So at the start. Great. So I'm going to come to David and then to Tracy. David, over to you.
Yeah, I'd just like to thank the group for taking part. It was really great discussion that we had, a real mix of people from different services and professionalism and academics. One point that we raised, and it's maybe was raised that it's not just a long COVID issue, but is that within the healthcare system needs a centralised database for information sharing. So many people are having to use all their energy to repeat their story all the time. People are losing information that's not valid at times, and when they're going to speak to people, they're just regurgitating stories and stories again. So we're looking for a centralised database that would hold all that information and really bring together that integrated care that everybody's wanting. Again, we spoke about the voice of the lived experience needs to be at the forefront for co-production, that people are being invested in speaking to them. One thing that was brought up was, again, the need for financial assistance, but the talk of benefits. When people were diagnosed, there was no talk of benefits, or if it was impossible to negotiate, or there was barriers in place. So there needs to be better looking at benefits and how we can get there. Again, what's been touched on as well about maybe a one-person coordination for support and guidance, where we're having to go across to all different specialists and taking a long time for referrals. If one person could be involved in that care plan and could coordinate it. And based other things like digital's became the default now. Are we able to reach everybody that's got long COVID and supporting them? And it's not just through a digital platform. We need to look from a human rights-based approach that we're reaching out to everyone, Alan.
Thank you, David. Very important extra points mentioned there. Tracy, and then finally Rob. Tracy, over to you.
Hi, and thank you very much to the breakout group. who brought us some excellent points, most of which have been already covered. But one thing that did come up was mental health and the psychological impact of having a long-term condition, especially one as interesting as long COVID, where you don't know when you're going to get better, how you're going to get better, that sort of thing. And we also talked a bit again about sort of diversity, about how, you know, children and young people aren't really being regarded as much as the sort of key demographic. And also men as well, who somebody made a point that maybe more, although there is a lot of physiological reasons why women seem to be affected more by it, but are there more men suffering from long COVID that we don't know about because men are less likely to actually go to the GP with their problems?
Thank you, Tracy. Rob, finally over to you, please.
Thanks, Helen, and thanks to sort of everyone in the group for sort of so many sort of kind of fantastic thoughts and things, and have had sort of quite a sort of tough time trying to sort of write down and sort of summarize so many things that were said. I guess in terms of some of the key things that came up for us, and sort of similar to others, one of the sort of key points was sort of listening to the voices of lived experience from people who are living with long COVID, leaving them and making changes as a result. That people need to be sort of round the table where decisions are made. And there's sort of a lot of discussion about need for an integrated approach across the NHS. That's not happening just now, but also other support services. So across social care, sort of social security, need for sort of advice and referrals to sort of support services for people who haven't necessarily sort of needed to use them before. Sort of need for better information on long COVID for clinicians, for NHS professionals. The sort of the guidance is sort of quite patchy, and that sort of some people have had to sort of come up with their own guidance because it doesn't exist, or people being told that, oh well, it's just guidance, so we don't need to follow it. There's sort of a need for kind of advocates and people to sort of help sort of go in and speak up for people living with long COVID, to sort of hone in on sort of some of the links that have been made today between people with lived experience, between organisations, and sort of coming up with an action plan for sort of what we can do, and sort of who who needs to do it, and like this, and also need for awareness raising and to let people know that you're not alone, and this isn't something that that you have to go through alone, and that people that there's a need to sort of take sort of urgent action, now. So yes, so sort of thank you to sort of everyone, and hopefully I've done our sort of discussion justice.
Great. Thank you, Rob, and thank you to all the facilitators for helping to run this event.